The other thing I want to pick up on is Becky and the other nursing students all mentioned the importance of frontline advocacy. And you've just mentioned now, Shari, that WHO is suggesting developing a social movement and political activism. And that's how I'm taking this, that's where this talk is going. I'm going to be encouraging you, all of you who are keen to do this, is to get politically active, because our planet and our species is at stake here. So with that, I will plunge into my presentation and talk, first of all, about COVID-19. I guess many of you have been on the front lines. It sounds like you have. And you've probably been totally absorbed in that and unable to really think about some of the other big problems we face. But the fact is, we have other major crises in Canada that are not being acted upon. And climate change is the first and foremost of these. And it goes along with a deeply dysfunctional political and economic system. And I mean, we're slightly better than the US, which is even worse. But these are huge, huge crises. And climate has been declared an emergency, but nobody's acting politically as though it really is. So there are lessons from COVID that I think apply to addressing these other crises. And I just want to review those a little bit in case you hadn't thought about those. So the first important one is to not ignore really good scientific evidence. On COVID, we had very powerful, incontrovertible evidence that a pandemic was forming, but we were just a little bit slow in Canada to act on it, and even slower in the US, whereas a country like South Korea, for example, picked up on that very quickly, took appropriate action, and they've had a far fewer deaths than they otherwise would have. So the important thing here is not to, I mean, it's a human evolutionary trait that if a problem is kind of way in the future and it's kind of vague, we can just put it off, like Donald Trump does every day, and not even think about it, let alone act on it. But I'm going to plead to every one of you not to take that stance. Climate change is too important to ignore, and if we don't act now, we face a huge number of avoidable deaths and the potential annihilation of life on Earth. So this is so important. We have to take this urgently, and I'm hoping this network that we're working with here will turn into a social movement that we can get political action. So this is going to be quite a political presentation. The second thing we've learned is that you have to have good government leadership, coordination, and resources to resolve these major crises like COVID presents. And that takes government at all levels. It takes federal, provincial, and municipal is very important, and often right down to the neighborhood or at the level of a tent encampment, right? For example, in Crab Park, there's a pretty good governance system there, and it works. And the other thing related to that is, how do we get the resources to address these crises? And you will have noted that for COVID, we've been able to, within a few weeks, mobilize hundreds of billions of dollars. We've never seen anything like this in the country, even during war, to so quickly mobilize such resources. So it can be done, it can be done quickly, and it can be affordable. I'll come back to that. The third point I want to make is that public health officials and politicians can be both credible and respected leaders when they're offering sensible, science-based policies and actions for politicians and for the public. And that is a powerful thing. So every one of you as a health professional can become a leader and can help to change policies. The next one, please, Sherry. And the other thing is, the citizens themselves, when faced with crisis, are very trusting of the government and of leaders, and are willing to make huge sacrifices. We've seen people just radically change their lives every day, and they're open to changing their behaviors and wearing masks and distancing and all of that stuff and staying inside. And they're also open to very progressive policies, and we have to take advantage of this. It was Milton Friedman, that right-wing economist, who has remarked that, you know, when you're in the middle of a huge crisis and you're trying to get into recovery, it's the ideas that are lying around, as he said, that get picked up on. And so what we've got, our job is for people that are interested in equity and justice and humane treatment of other people, and the social determinants of health, we have to get the ideas out there that that will create better policies, better government, better democracy. So that's what I'm going to try and outline here for you today. The other lesson is that those who are most likely to get sick and die from COVID were the poor, the marginalized, those living with isolation, Mark, as you mentioned, the racialized, and especially the elderly in care facilities. And largely there because the workers were poorly paid and often immigrants, and you know, we're moving from facility to facility to get a living and carrying the bug with them. And the last one I'll mention here is that we've learned here is that we absolutely have to put the health and well-being of the population ahead of corporate profits. Next one, please, Sherry. So just a few words about the climate crisis. I'm sure all of you fully know this already, but for those who may be particularly new, I just want to cover this. So we know that from good climate science, the globe is warming because of the continued emission of greenhouse gases, primarily carbon dioxide. And the planet continues to warm up even though we've been talking about it for years. And we've passed the point probably of being able to keep warming below 2 degrees. And once it gets past 2 degrees, we get to tipping points and unpredictable things that are going to happen. And unless we take urgent act, we have to take action like right now, this year, and during this crisis. If not, we're on the way to increasing impacts, more pandemics for sure, fires, droughts, crop failures, famines, floods and storms, and on, which are going to displace people and cause more massive refugees, and on it goes. And eventually, if the climate gets too warm, we'll have massive famines and the inability to feed people, and we'll face annihilation as a species. So our goal that we have to focus on totally here is to get to net zero greenhouse gases by 2050. So we've got 30 years. This is a 30-year window. And that may seem like a long time, but boy, with climate change, this is a short time. So we need action right now. I want to stress that. And that's by hoping to mobilize every one of you to push our political system to get to action, because we haven't been doing it so far. We're going to require a total transformation of our economy and our political system from fossil fuel dependence to all renewable energy, while leaving nobody behind. We don't want to see the poor and the homeless left to die in this process. And all for constantly putting people before profits. Next one, please, Sherry. So we've got two huge choices, one big choice between two options here. And I'm going to make this basically political choices. So the first choice that many people are already pushing for is to go back to business as usual. Big business was doing fine under pre-COVID. They were making lots of money, and the wealthy were getting wealthier, and the rich were getting richer. And that was under this, our historically free market, austerity, neoliberal, profits before people capitalism. You can put whatever words, and I'd like to hear back from you when we get a moment to talk about it a bit, if we have time, is to hear what your words you would use. But you know about this, neoliberal economics, which is small government, inadequately funded public services, more privatization as so much long-term care was, huge socioeconomic inequalities, and a huge concentration of wealth amongst the already wealthy individuals and particularly corporations. Persistent family and child poverty, homelessness, exclusion, isolation, marginalization, racism, going along with precarious employment, stagnant wages, and many people just feeling that their lives were meaningless, and which led to the deaths of despair, increasing addictions and suicides and homicides, and a dropping life expectancy and ongoing global warming. So that's business as usual. That's option one. Option two, which seems a no-brainer to me, but maybe not all of you agree, that we want to push for a more humane, egalitarian, sustainable people before profits economy with a stable environment and a stronger, progressive, democratic political system, which features full employment with good wages, the end of poverty, the end of homelessness, well-funded public services, and all renewable energy. Next one, please, Sherry. So those are our two options that are facing us. As a quick summary, climate change is an existential crisis, and we've got inequality and we've got declining democracy. We've got to move from fossil fuels, and they're already on the decline. They're commercially becoming less and less viable, and we have to eliminate them as a source of energy to stop further, and that has to be done urgently. Our energy needs can be met with 100% renewables, and I can give you any number of references to back that up. The transformation to a renewable energy economy and society is, to quote Noam Chomsky, is doable, practical, and affordable. And moreover, he says, some form of a Green New Deal, a GND, is essential for our survival. So, and the practical and doable part of this is this can be financed. It's going to take billions and billions of dollars to do this, but it can be financed through a mechanism called quantitative easing, which I can talk about, and using wise investments to get economic growth uncoupled from emissions. The result, hopefully, will be healthy people and a healthy economy and a healthy climate and the end of neoliberalism. The next one, please, Sherry. So how can we do this? Well, as you know, there's hundreds of billions of dollars already being provided for stimulus funding. But the important lesson from the great financial collapse in 08 to 10 is that when the funding goes out, it must go out as public investment in productive products, in this case, green infrastructure. What happened in 08 was the money went out, but it went into the financial world and never created anything meaningful for people to stimulate the economy. It's just, so we have to do this by investing in a green infrastructure, particularly renewable energy and increased energy efficiency. Talking about energy, particularly increasing the energy efficiency of all buildings and all transportation. And I haven't got time to go into all the details, but the other part of this is a smart grid with increased transmission and increased storage capacity and increased renewable energy generation, mostly wind, water, and solar, but perhaps some geothermal and hydrogen as well. And investing in both public and private services. In the public realm in Canada, more investments in health, particularly in public health, mental health and addictions and long-term care. And in the broader care communities, increased and free child care, care for the disabled, and better care of the elderly. And in education, early childhood education and free education right up to post-secondary level. And to prepare for the people that are going to be displaced from their jobs because of the decline of fossil fuels, we need to have skills training, occupational and vocational retraining for hundreds of thousands of people. So that needs to be included here and will provide employment. And huge employment potential here in construction, transportation, and so forth. As I mentioned earlier, this can be funded through, and reasonably and sustainably, through fiscal management, running deficits, running up debt, but keeping the debt to GDP ratio is entirely possible here if we invest in the kinds of things I've suggested above, which will create jobs, which will in turn create taxes and people spending money. So we will have economic growth and therefore a sustainable fiscal situation. Next one, please, Sherry. And the result, as I say, will be thousands of new jobs with good pay, a living wage or more, benefits, unionization, increased worker empowerment, co-ops, co-ownership, and so forth. A job guarantee. Everybody who's able and willing to work will be guaranteed a job. And as I say, with good pay and benefits. We need more affordable and efficient housing. We can get to no poverty and no homelessness. We can decrease wealth concentration and inequalities. We can have a well-educated, empowered workforce, all renewable energy and climate stability. We'll have a fairer tax system. We need to increase the carbon tax, but also increase income and wealth taxes for some people, and the issuance of government bonds for funding all of this. This will result in decreased energy costs. I mean, these are far cheaper ultimately than fossil fuels are. And we'll get to net zero emissions, economic growth, decoupled from these emissions. Okay, so next one, please, Sherry. So how do we get there? So this is the path to a Green New Deal. There is already a vast network across the country with 500 organizations. It's led by, at the moment, by 350.org and Lead Now. The work is proceeding in 3 phases. The first right now during COVID is the response phase, which runs to the end of June. And then we go into the recovery phase, which is July to November. And that is, as the next bullet says, building a social movement. And then once that's done, from December and moving into the 2021, the new year, will be to get some legislation in place, some version of a Green New Deal by early 2021, as a base then to develop a plan to resource and implement this idea over the next 30 years to get to net zero by 2050. And the result of this will be a healthy climate, healthy Canadians, and a healthy economy. I just want to mention the principles that have come out of this Climate Action Network very quickly here. I know I'm running out of time, but the first is that health and well-being of the people has to be the first priority over corporations. The second is to build a stronger safety net and relief directly to people. Don't give it to the businesses and bailouts. Get the money straight to people. The next one is increased resilience so we can withstand a future challenge. So resilience meaning adequate incomes, housing, education, and training, and so forth, both men and women. And the next one is increased solidarity and equity across communities, across generations, across borders, and across cultures and racial groups. And then lastly, the extreme importance for Don will, I'm sure, will support for Indigenous rights and partnerships with Indigenous communities. The next one, please, Sherry. So how can you take action as frontline workers? Well, you can start doing your own teach-ins. These slides are freely available. You can use these. There is this motion M1 is before Parliament. It's motion M1, a Green New Deal for Canada. There's a petition that goes with that. If you Google it, you'll get a petition. You get 25 signatures on a petition. That empowers you to meet with your MP and tell your MP that he or she should be supporting a Green New Deal for Canada, and be willing to stand up in Parliament and speak for it and to vote for it. And then you can send letters to the Prime Minister and key ministers. Jonathan Wilkinson from North Vancouver, Catherine McKenna, I forget where she's from, and James Guilbeault from Quebec have been named by Trudeau as an equitable green recovery team. And I hear that Bill Morneau, the finance minister, and whoever's the Minister of Innovation have all been asked to join that team. So there's people you can send encouraging letters to, and you could encourage them to get beyond partisanship. This motion is a private member's bill from Peter Julian. It's not a partisan bill, it's nonpartisan. And if the Liberals and Greens and Bloc and the NDP all line up together, this could be passed. And then you can take local action at municipal levels, and there's lots to be said about that. And if anybody wants to ask questions about how you can take local action, I can tell you about that. So please stay in touch. I'm going to sign off here by saying, for me in my entire career, this idea of something like some version of a Green New Deal is the biggest opportunity to improve health in this country in our lifetime. So I hope you'll get on board with this. So that's it for now.